So let me get him on the phone. Good morning. You're on KSJE. Thank you for calling in this morning.
Hi. Good morning.
Dr. Herrington, good to talk to you.
Yes. This is different. No, I don't have to wear a tie this morning. I'm on video.
That's right. We didn't have you on Zoom today, but we got you on the phone. So thank you for joining us.
Sure. Happy to be here.
And we assume you're at least wearing something.
Oh, gosh. More than just the white coat, I hope.
There you
oh,
are.
Goodness.
There you are. We have a picture of you in a green shirt, so that's how I'm picturing you, Dr. Harrington, right now. There you go.
Good. That works, yeah.
Thank you, sir. But we wanted to get you on the program to talk about the news about the vaccine, the COVID vaccine, and being authorized for use, at least one of them, right, with younger folks, now children 12 to 15, correct?
That's right. Yeah, that was the news this week, that the FDA on Monday and then the CDC came along yesterday, giving the green light to go down to age 12, where it used to be that the Pfizer vaccine you could go as young as 16. So that's good news. We're pushing it closer to the younger ages.
Great. And so can you talk to us a bit about the difference between this partial and full approval? Is this in the full approval stage? Does that take 6 months? I'm a little confused myself there. So can you speak to that?
You know, I'm not really an expert on the details. That's a good thing. You're correct. So far, all these vaccines are still under what they call an EUA, Emergency Use Authorization, and I don't know what it takes for the timeline for them to become fully approved. I think it should be coming soon for the adults, and so I don't know what goes on in the FDA to move somebody from EUA to full approval. I know the company has to request that it be approved, and I don't know where they are. You know, there's the other two vaccines as well as Pfizer that are approved for adults, and they've all had plenty of, they've been given to millions of people. So I don't really know what the timeline is for that. But you're correct. Right now, so far, everything's under an EUA.
Very good. And I think I heard, Dr. Herrington, that Pfizer had requested maybe that other just regular authorization from the CDC for adults, as you mentioned. But with children now, are you getting questions maybe from some of the parents of your patients of, what to think about the vaccine? And of course, I think a lot of the advice has been if parents are concerned about even themselves getting the vaccine, the place to go for information is to their medical professional and to ask them, what their thoughts are, correct?
Right. Yeah, that's always sort of the best idea, because your doctor or provider knows you better than anybody else does. But I don't really know any physicians who are giving anything other than a thumbs up for vaccinating against COVID in the context of the alternative being unvaccinated and being at risk for a real severe illness. And so I'm even stepping out. Like, I had a family yesterday where the kid was 15, and so he's not eligible yet, but I asked the parents, why haven't you gotten it? Well, we're kind of scared. And so we talked a little bit about how the vaccine is not scary, the disease is scary. And so I don't know any adult providers who disagree with that. So I think within the medical community, there's not much controversy about the vaccine being a very good idea.
Right, true. And I do want to make one clarification. I think FDA is who approves these vaccines for use, correct? Not the CDC. I misspoke, and we don't want to do that and sharing correct information. Pardon me.
Yeah, typically it's both. So like the FDA gives approval, and then the CDC will give recommendations that it be given. And so I don't know of an example where they don't agree, but so typically they will, like before they're given in New Mexico, for example. And of course there was only a 2-day difference between the two, but you're right. Technically the FDA is who gives what they call the approval, and then the CDC they have recommendations, as does like the Academy of Pediatrics, the Academy of Family Medicine, and they, for the most part, they'll all line up when it comes to vaccines.
Right. And so I have a question about, so it was 16 plus, it was approved for that age group. Now it's 12 to 15. What is the logic there? Are we eventually going to keep ratcheting down the ages so that it becomes like, mumps, rubella age kiddos, or how does that work?
I think so. My understanding is that they are already doing studies on kids as young as 2. And so I think the expectation is in a few months they will have data that it's safe and effective. My guess is the next sort of obvious cutoff is 5 to 11, because that would then include all school-age kids. And then the final step might be 2 to 5. And I don't, I guess we'll see how it goes, whether below 2 also comes at some point, or whether the data just supports. By that time, we may have enough herd immunity that kids under 2 aren't a concern. But yeah, so because it's kids, we're sort of cautious and making sure you do studies to show that it's safe and effective, and then you just kind of work your way down. But yes, I would say I heard a podcast this morning that they were predicting maybe by the end of this year or the start of next year that they might be talking about 5 to 11.
Interesting. And I guess the delay, Dr. Herrington, would be just in the normal testing of new vaccines, as we saw, right? And I guess the priority was to get the vaccine out to the elderly and adults, which is why it was made available first. And those were the groups that had the first tests and the first trials, and then it moved into the younger children. And that's kind of what we're seeing. And that's really the reason for the different time periods of when it's been released for emergency use for these different age groups?
Yeah, I think in my mind there's 2 factors that both line up. One of them is that, the older you are, the higher your risk of severe disease. So unlike some diseases that affect kids worse than, say, 50-year-olds, the real risk of people being very sick and dying goes up a lot with each decade of age. So it made sense to focus on that. And then I think also as a society, with almost anything, if there's a new medication that comes out, you won't see it being initially given to kids. So I think as a society, we're more willing to tolerate if you're going to have, quote, guinea pigs, that they be adults, and then once you have a good safety profile with adults, you say, well, okay, now let's take a look. If it was causing awful side effects in adults, then that would probably be enough to say, well, then we're not going to give it to kids until we get a better product that doesn't have as many side effects. So it seems to be the natural progression, and in this case, it made sense because the younger you are, your odds of getting severely ill go down. Now, it's not zero, and we do need herd immunity, so I think that's why the timing is appropriate now that we've all of the adults who want it, and basically the supply is catching up, so the timing is just right now to say, okay, now let's start giving it to the younger kids, whereas that wasn't really a priority 6 months ago.
Very good. And have you heard anything about schools requiring these vaccines? I mean, they require other vaccines with some few exceptions. Have you heard anything about that regarding this one? Is that coming later?
I wonder, what I have heard is that some colleges are requiring it, which makes sense because, today, if you're college age, you can get it. I think it's too soon. It'll probably go state by state. So it may be that some states at some point say, well, just like when you're 11 years old, you need to have a Tdap, tetanus, diphtheria, pertussis, that it wouldn't surprise me if they say, well, when you turn 11, you need to get the COVID booster in a few years. One thing is it's a little hard to require something if it's still only an EUA and it's not FDA even fully approved. So I think once you start having approval, then more employers and schools and public situations then will be on less thin ice to require, sort of legally to require something that's not even fully FDA approved. I think has some people a little hesitant. So, but if I was a betting person, I would bet that in 5 years that it is required for older kids. Wouldn't surprise me at all.
Gotcha. Interesting. And Dr. Herrington, I wanted to ask you too, a little bit about what we're seeing in children. And again, you mentioned that so far, children have not been as mostly affected by COVID as older adults and seniors, of course. But there have been cases, correct? And there even have been cases locally, I believe, in younger people. And so it's something that, again, as we learn more about this virus, right, and this infection, it is something that everyone really needs to be paying attention to, isn't it?
Yes, I agree. And initially, we were thankful that it was very rare among kids. That was a blessing. But as more and more millions of people have gotten it, there's something like a few tens of thousands of kids that have ended up in the hospital with it. And last I heard, over 300 kids had died from it. So that's worse than the flu, for example. There's also this other complication that is kind of after the infection is going away, the body kind of has an overreactive reaction to it, and it's called this multi-system inflammatory syndrome of childhood, where they get fevers and sometimes go into shock and have seizures and stuff. And there's been about over 3,000 cases of that. So that's correct. It's not that we're just vaccinating the kids for the sake of not spreading it to the rest of us more mature people, but it is actually, although it's rare, it can be a problem for kids as well.
Very good. Well, Dr. Herrington, thank you so much, as always, for joining us and giving of your time and expertise.
Well, it's always a pleasure. Nice talking to you guys.
Thank you.